Alright, team. Here are the symptoms we are dealing with. Eosinophilic fasciitis, laryngitis, and chorioamnionitis. What could be the diagnosis?
I think it could be an autoimmune disease like eosinophilic fasciitis.
Or maybe it's an infection related to chorioamnionitis.
I'm leaning towards a throat issue like laryngitis.
I already said laryngitis is one of the symptoms.
Next time, Randall, just say something like laryngectosis.
Shut up.
What about a rare condition that could cause multiple symptoms?
No. It's none of those. This patient was bitten by a cat.
A cat bite? How do we miss that?
How do you get laryngitis from a cat bite?
What's the treatment then, Dr. Hawks?
We have to perform an anterior temporal lobectomy.
But that's a risky surgery, Doctor.
I don't care how risky it is. It's the only way to save the patient. We must proceed with the lobectomy immediately. Tracy, I need to perform an anterior temporal lobectomy on my patient. I'm almost certain it's a cat bite.
Hawks, let's slow down a bit. Are you sure about this diagnosis?
Tracy, I've been in this field for years. I know what I'm doing.
How the hell is an anterior temporal lobectomy relevant to someone getting a cat bite? Did the cat bite the patient's brain?
Not very well, hence why we need to finish what the cat started.
I pray that you're joking. This is only going to go wrong.
While you're in the midst of praying, ask the old man upstairs for some faith. We have a patient to save, goddammit.
Holy crap, the patient is in critical condition. We need to act fast.
Anterior temporal lobectomy was not the right treatment for a cat bite. Dr. Hawks should have listened to us.
We need to figure out the correct treatment. Maybe antibiotics or antiviral medication.
I don't have any of those to spare right now. I sold a whole case of antibiotics last night at the swap.
Why and how do you still have a job at this hospital?
There are some things we just don't question, like why we performed a lobectomy on a patient who got bit on the ankle by a cat.
How could you all be so incompetent? A cat bite. An anterior temporal lobectomy. Are you all trying to kill our patient?
We're sorry, Hawks. We didn't mean to make such a grave mistake. Normally we try not listening to you and consult with logic and reasoning.
What do you think the correct diagnosis is then, Hawks?
Yeah, please tell us what we missed.
We need to learn from this, Hawks.
Oh, you all are a disgrace to the medical profession. It's not my job to do your thinking for you. Figure it out yourselves, you bunch of imbeciles.
A cat bites a man's ankle. You plead and beg with us to perform a lobectomy, then blame us.
Exactly. All of this could have been avoided if you weren't idiots.
You're right. It's my fault I don't go to the streets and publicly adopt every single kitty cat to prevent such disasters.
Hey, Johnson, how are your patients in oncology doing today?
They're actually responding quite well to the treatment. I'm really hopeful for their recovery.
Great. Anyway, have you ever come across a case where the symptoms just don't seem to add up?
Oh, all the time. It's part of the thrill of being a doctor trying to solve those medical mysteries. Let me guess, it involves a cat bite.
How did you know?
Well, my cousin's kids had a cat up until a few days ago who ran away, and having looked at some of your patients by chance, it looks like the cat that bit them has a very familiar bite.
What are you getting at?
Is it possible it's the same cat that Timmy and Sarah have been looking all over town for?
Well, let me see. Did their cat have a habit of biting at the ankles?
Yes.
Did it look like 4 distinct teeth marks?
Also, yes.
That narrows it down. I still have 100 cats at the local pound with identical teeth marks to identify. Also, the patient has owned this cat for longer than your cousin has been dead for. Do you really want to suggest to those kids that the cat you gave him was really theirs to begin with?
It was just a guess.
It was a stupid one. Anyway, thanks for wasting my time. I figured out the case before I even sat down. I have an urgent matter to discuss with all of you.
Hawks, what are you doing here without the proper gear? You can't just barge in like that.
This is highly unprofessional, Hawks. You need to respect the safety protocols in the operating room.
Yeah, what's going on? Why are you risking everyone's health like this?
Listen, I know I shouldn't have come in this way, but I had a breakthrough. Cat bite was a misdiagnosis. It was mouse bites.
You've got to be shitting me.
Tracy, I have to admit I was wrong about the cat bite. It was actually mouse bites.
You cannot be serious. I don't think you've even come up with the real diagnosis.
No, I would never joke about something like mouse bites, which is normally something I suggest as a treatment, not a diagnosis.
If the next words that come out of your mouth involve the term medicine drug, you can just forget about the board of directors possibly siding with you on terms of your employment here.
Drug medicine.